Have you ever forgotten where you put your keys or struggled to find the right word in a conversation? While these moments happen to all of us, if they start becoming more frequent and worrying, it might be a sign of something called mild cognitive impairment, or MCI. So, what exactly is MCI? It's a condition where someone experiences a noticeable decline in their memory or thinking skills, more than what's typical for their age. This might mean forgetting appointments, misplacing things often, or finding it harder to plan daily tasks. You might also notice changes in language, like struggling to keep up in conversations, or even visual challenges, like having more trouble with navigation or judging distances. But here's a crucial point. MCI is not dementia. While for some, it can be an early stage of a condition that might lead to dementia, it doesn't automatically mean that will happen. For many, MCI can be caused by other things, like sleep problems, side effects from medication, or even stress. And unlike dementia, the changes in thinking and memory with MCI don't usually prevent a person from managing their everyday life and staying independent. If you're concerned about yourself or a loved one, what should you do? The first step is to consult your doctor. They can review medications, check your overall physical health, and run some blood tests to rule out other causes. They might ask you some questions to get a sense of your memory and thinking skills. If your doctor suspects the symptoms are related to your cognition, they might refer you to a memory specialist. This specialist will do a more in-depth assessment. They'll ask about how the problems are affecting your daily life and will likely conduct some tests to evaluate your memory and thinking more formally. Sometimes they might recommend a brain scan to get a clearer picture and rule out other issues like a brain injury. A diagnosis of MCI is usually given when your cognitive abilities are worse than expected for your age, but you can still handle your daily activities. Now, what about treatment? Currently, there are no specific medications licensed to treat MCI, only preventive activities that might retard its progression. However, if an underlying issue is found, like a vitamin deficiency or a medication side effect, treating that can sometimes improve the symptoms. For many, though, the cause isn't clear, and it becomes a case of monitoring the situation. A healthy lifestyle changes like a balanced diet, regular exercise, and staying socially and mentally active is recommended, as these are known to support brain health. Remember, noticing changes in your memory can be scary, but getting it checked out is the most empowering step you can take. Understanding what's going on is the key to managing it effectively. Thanks for watching. If you found this helpful, please give it a thumbs up and subscribe for more health insights.